Well, I don't feel like they're using it for not being productive. I do feel like a lot of times we don't really truly understand what we may be experiencing a lot of times. I feel like there are a lot of emotions, there are a lot of sensations in our bodies that we're not taught how to manage, and which could lead to not going to work. But also, what you'll see is people say it's expensive because of maybe insurance. So if you don't have insurance, then you might not have access to services as other people might have. And that's what I'm starting to see, especially within, my practice. Some people might not have the accessibility to these services because they can't afford them. And so if you don't have insurance to help cover that cost and you don't have a job to where you're making enough money to pay for these costs, that is a great question because a lot of times people don't know the questions to ask a therapist at the beginning before they even start services. And what starts to happen is they'll pick someone just off of a picture or pick someone off of a description they see online, and then they go meet with them and there's not a connection there.
Welcome to the Unfiltered Minds Podcast, the only culturally diverse podcast where we discuss ways to destigmatize mental health, as well as promote self-seeking behaviors amongst our youth and family members struggling with ADHD or depression. Now, here's your host, Jane Levy.
Hello, everyone. Welcome to the Unfiltered Mind podcast. Again, this is a platform where we discuss ways to destigmatize mental health, as well as promote self-help seeking behaviors amongst our youth and their family members in the Black and Brown community. Today, we're going to talk about things we all should know about depression. Without further ado, ladies and gentlemen, I present our guest speaker for today, Terance. Terance, please introduce yourself to our guests and our viewers.
Yes, my name is Terance Dawkins. I'm a licensed clinical social worker. I'm actually located in Spartanburg, South Carolina, and I work at a college university counseling center, but I also have my own private practice entitled Missing Pieces Counseling Services.
Appreciate that. Appreciate that. And first question, Terance, is it's going to be who is Terance, right? And let's talk about why should anyone listen to what you have to say today around the topic of depression. And feel free basically to talk about your current role, right, in your practice in the mental health space and just the background of your education as well.
Okay. So I went to Winthrop University where I got my bachelor's and master's degree in social work. And upon getting my master's degree, I decided to move back home to Spartanburg, South Carolina. And for a moment, I worked in a hospital setting as a case manager where I did assessments in the emergency department for those with mental illnesses to determine whether they were a risk to themselves, a risk to anyone else, and needed involuntary commitment. And I did that for about 4 years. And while doing that, I also was getting supervision in order to be a clinical therapist and to be a licensed clinical therapist. And once I did that, I started working for a college university located here in Spartanburg and transitioned to a college university in Greenville, South Carolina. And I also opened my private practice about 2 years ago. And I believe the question you asked was, why should anybody listen to me? And that's a great question. The reason why I got into this field was mainly because I saw how my mother used to struggle with depression symptoms and shutting down behaviors and how she would isolate herself from others and from us as well as a little kid. And that kind of stuck with me. And I also saw those same similar behaviors within myself, especially when I was in college, but I never sought out help. I never sought out counseling or anything like that, even though those resources were available to me on the college campus. So the in order for me to help myself, and I felt like I needed to help others who were having some similar issues, that's what really got me into this field of mental health.
That's wonderful. And basically, you're speaking from past experiences as well. And that's really important when you're talking about mental health space, right? Because people want to relate to people, right? They have gone through things that they're actually struggling with. So appreciate you sharing that. And let's talk about millions of people are diagnosed with depression itself, but yet still it's widely misunderstood. Do you believe a large percentage of people are using the label of depression for not being productive?
Well, I don't feel like they're using it for not being productive. I do feel like a lot of times we don't really truly understand what we may be experiencing a lot of times. I feel like there are a lot of emotions, there are a lot of sensations in our bodies that we're not taught how to manage when we're growing up at a younger age. And since we're not unable to deal with these difficult experiences or difficult situations, we do fall into a moment of sadness or moments of feeling hopeless or helpless, and we will label it as, oh, I'm feeling depressed. And a lot of times what you'll see is people will use the word depression, but if you look in the the DSM, depression is a diagnosis where people will experience symptoms like low motivation, low energy, uh, sleep disruption, appetite disruption, crying, extreme crying. But these symptoms last over a period of time. It doesn't just last for a day. It doesn't just last for a couple of days. It's a pattern of a lot over a period of time, an extended period of time. So you could have situational depression, but that doesn't mean you are actually someone who lives with depression chronically.
I see. So, what would you describe as chronic depression?
Chronic depression would be, I'm feeling these depression symptoms as labeled in the DSM for maybe a week or a couple weeks at a time. But then maybe I'll have moments of relief, but those symptoms continue to come back. And it's not driven by a specific situation or circumstances, such as, oh, I broke up with my partner, so now I'm feeling sad, so that must mean I'm depressed. Or I lost a relative or someone, and I'm sad about that. That means I'm depressed. It's a chronic. When I say chronic, it means it's a repeated pattern, even when you possibly do have those periods of relief. And sometimes you don't have periods of relief, and we call that persistent depressive disorder. So it really just depends on what's the pattern, and those are some of the questions that we ask: is what are the symptoms you're experiencing? When did they start? How often do they happen, and how long have they been going on for? And that helps you determine whether that's something that's situational, whether that's something that's a depressive pattern, or whether that's something that's very persistent.
Wonderful. We all do know, thank you for that response. That was great, really great. We all do know about the percentage of Black and Brown therapists in the industry are limited, right? A lot of times we as a Black people tend to want to go to a therapist that look like us and know what been through what we've been through, right? That's culturally competent, but most of the time we don't have that chance, right? The opportunity, because it's only a small percentage of you guys in that space. Which leads to my next question. Black men do suffer from depression as well, right? But they just don't express their sadness as readily as women. In your practice, are you seeing a lot of Black male or females?
And that's a good question because I see more Black females than I would do males. But even though I see more Black females than I do males, I still don't see a lot of Black females as well. So I would take that as us as African Americans or Black people, we don't seek out services when we're struggling. And that could be because of the stigma, that could be because how we were raised. And I am really studying this concept called intergenerational trauma, which is ultimately the trauma that is passed down to us from our parents or ancestors, and how those beliefs and how those things that we were taught impact us now. And how does that relate to this specific question is, we may feel like we may be depressed, but we don't identify it as being depressed. We just feel like this is a difficult moment. I have to get past this. I need to get past this, and I can get past this because maybe, if I don't, then that means I'm weak. Or if I don't, that means that I don't have much value. So those are things that's probably taught to us from our parents or ancestors, and that could even go back to historically to like slavery or other type of traumatic events that our ancestors might have experienced, and they needed to adapt in a certain way in order to survive. And so I believe that we are ultimately still utilizing those survival techniques and survival tactics and skills, even though they probably don't best serve us now like they served our ancestors or parents before.
I believe that too. And that's why as adults, young adults, we have to be open-minded. Like I told you, my situation, my son was diagnosed. I had the choice to either get the resources that I need to educate myself on ADHD because that's not something I'm familiar with, or just be closed minded and don't do anything about it. And then when it's gone untreated, we'll also know that those illnesses can also lead to anxiety disorders and depression
Hmm.
disorders when
Yep.
ADHD is also gone untreated. So I do a lot of podcasts and I do a lot of reading CDC. Like you mentioned about the DSM-5, but probably there's even not a lot of people that knows about the DSM. That's like the
Yeah.
Bible for mental health, where people
Yes.
can actually go and look it up. But yes. So it's great you brought that up. I was reading an article. According to the World Health Organization, depression is now a leading cause of disability globally, and it's
Hmm.
very expensive. What are some of the causes for that statement? When they said it's expensive, are we seeing a lot of people when they're depressed, they're missing work?
Yeah, so s- people can end up missing work if their depression symptoms are severe enough to where they can't get out of bed. And like I said before, some of those symptoms could be low energy, low motivation, feeling hopeless, feeling helpless, and those things sometimes can be debilitating, and which could lead to not going to work. But also, what you'll see is people say it's expensive because of maybe insurance. So if you don't have insurance, then you might not have access to services as other people might have. And that's what I'm starting to see, especially within, my practice. Some people might not have the accessibility to these services because they can't afford them. And so if you don't have insurance to help cover that cost and you don't have a job to where you're making enough money to pay for these costs, then guess what? You probably won't receive the services. And then that could also be a deterrent for you to actually seek out services because you might try and you keep getting denied and denied and denied. And that sense of rejection just adds to the depression and exacerbates those symptoms to where people then just feel like giving up.
I agree. I agree. It can be very those copay can add up as well.
Yes.
It can add
Yes.
up definitely. Thank you for sharing that. Yeah, and not only missing work, people are not productive at work. A lot of
Hmm.
disciplinary actions also can lead to if it's not treated the right way.
Yep.
Yeah, but thank you so much for sharing that, Terrence. Moving along, another question I have: African Americans are most likely to share their children's feeling of depression or any mental illnesses with their pediatrician instead of their pediatrician or a mental health specialist. They mostly seeking help with their religious leader or spiritual leaders.
Yeah.
Do you
S-
agree or disagree with that?
So I'm glad you brought that up because um, mental health professionals are considered specialists. So they fall under a specialist pay range. So people will end up going to their primary care physicians or pediatricians to look for maybe medications or look for assistance dealing with some of these symptoms that they're experiencing, and it's low cost to them. But that professional does not specialize in mental health or mental health treatment. So sometimes what's going to happen is they will prescribe medication or they will give recommendations, but if the symptoms persist, then they're going to end up telling you, well, now this is out of my scope. I need you to go see a specialist. But then, like I said, those specialist visits could be not affordable to that person, or they don't have a therapist or can't find a therapist that they connect with or they feel like they can trust. And then that's also another barrier. So what ends up happening? If I cannot then find someone to help me, then I might go to my spiritual leader, and that's really no cost to me. But if we take it back to a historical standpoint, especially in the African American community, a lot of the places where we seek guidance and direction is from our spiritual leaders. So we're very spiritual people because if you look back in slavery times, a lot of times what they would do is pray. They would say, oh, God's going to get me through this. God's going to help me through this. They would sing these different spiritual songs or gospel songs to help get them through these different tough times. So that's something, again, that's intergenerational and that's kind of carried with us that in order for us to heal, we must go back to our spirituality, because that's what we always depended on, and that's what got us through thus far. And I'm not saying that that's necessarily the only thing that's got them through, but that's what they believed, and that's what they continue to teach their children, and that's to continue how it helps us move forward with seeking help from spiritual leaders.
I do. I agree with that because even with the black and the brown community that have resources to insurance, and I'm in a lot of groups where the younger generations are seeking help, mental health help assistance, and a lot of times when you hear the backstory, it's really, I was depressed and I spoke to my mom or dad about that, but nothing was done. All they did was pray about it.
Hmm.
So we all know that you can pray depression out of someone. I mean, prayer. I'm also a spiritual person, but
Hmm.
also you need to seek professional help as well.
Yeah. So, and I'm not saying that, and I'm not saying by any means that, not being spiritual is not always, the answer to some of the things that you might be experiencing. I'm not saying that at all, but I do believe that, you can be spiritual and you can also seek help from other avenues that you can feel like would benefit you. So I think it could be a combination of things, and I think that's how it could help.
Thank you. There are certain things that a lot of things we can prevent, right? That
Hmm.
can we can do to prevent stress because stress do lead to sometimes anxiety. Stress do leads to sometimes depression. Knowing yourself and not comparing yourself with others, some of those things that I have actually put in place, not only for me, for my children as well. What are some things as a therapist you can recommend for people to implement to prevent stress that can also lead to depression?
Well, as therapists, we always recommend people do things for themselves. So ultimately, self care. So a lot of times we will continue to always be on the go because we feel like we always have to be doing something. We got so many responsibilities, we got so many things that we have to get done that we don't have time to take care of ourselves or we don't have time to do things for ourselves. But I think that is very important to take that break and find something that you enjoy to help you with managing some of the stress. And that could be something as simple as reading a book, taking 15 minutes out your day just to sit and do nothing. That could be disconnecting from, technology, which could be social platforms. It could be disconnecting from your phone, disconnecting from your TV. But finding something that you actually enjoy and doing those things consistently, because that's something that an analogy that I like to use with my clients is if you have a thermometer and you continue to have high stress, then guess what's going to happen to that thermometer? It's going to continue to increase to the point where it bursts. But if you could do something to take care of yourself or do something that you enjoy, you help decrease that level to the point where now you can tolerate something more. You can tolerate a little bit more stress. But if you are always on the go, you always feel like you have to be doing something, that stress level is always going to be high to where it can take some one small thing and the next thing you know you overreact or you do something that you possibly regret or symptoms begin to get worse, so it's not really benefiting you to not do anything that's self-care related.
I agree. And I always tell my friends, especially summer is coming up, everybody's having a cookout, graduation, weddings. And sometimes you just got to say no to those invitations. You can't be
Hmm.
everywhere.
Yeah,
Yeah.
exactly. And
Yeah. Yeah.
I think a lot, and the reason, again, another reason why I think that we are always on the go is because we feel obligated to people. We feel obligated to
Yeah.
family members. We feel obligated to friends. And we feel like we need to maintain those connections. And if we say no to those connections, then that will interrupt that connection. And we as people and we as humans, we're people that we thrive off connections from other people. So if those connections are broken, and then that can also have an impact on our mental health because then we feel like we're isolated. We feel like we're alone. We feel like we don't have anybody. So, in a way, it's kind of like, well, I need to do this so that I can maintain these relationships, so I can maintain stability of mental health. But sometimes that can be harmful when you do it too much.
Agree. I agree. Thank you so much for sharing that. So, you've been doing this for quite some time, Terrence. Walk us through. Let's say you have a new patient that comes in the hospital. I mean, to see you. and
Hmm.
that's your first initial visit. What's the process like to be diagnosed? Is there a blood test? Is there a questionnaire? What is it?
So ultimately, when I get a new patient, it's I like to say it's mainly a conversation. And this conversation consists of getting to know that person, not just why they came, but getting to know some historical things about them, getting to know some family history about them, because that plays a major factor in what kind of symptoms they may be experiencing and expressing. So, of course, I start with just asking them general questions about themselves, just to try to build rapport with them in order to try to make them comfortable. And then I go into asking them what brought them to therapy and asking those questions, like I mentioned before, of how long have these things been going on? How often do they occur? Is there anything that happened recently that you've noticed? Because sometimes they don't notice that you've noticed to where it could have caused this to happen. I ask things such as their support system, because that's very important. And some people say, I don't have a support system. And when they say I don't have a support system, then that can let me know that maybe that's something we need to work on. I ask them about any type of drug or alcohol use. I also ask them about what motivates them or keep them going, because that's very important as well, because that shows that they have something they're looking forward to and something to strive for. I ask them about their strengths and weaknesses, because we can utilize those strengths in therapy to help them achieve the goals for therapy. And the weaknesses, we can also try to help improve those weaknesses so that it can help with the symptoms they're experiencing. But then the last thing I always ask everyone would be, what is your goals for therapy? What do you ultimately want to get out of therapy? And how would you know that you've reached your goals? What do you need to see? What behaviors you need to see change in order to say, I've done what I needed to do and I feel like I can manage it on my own now? So it is kind of like a questionnaire, but it's a structured questionnaire to where you take in a whole lot of factors.
Wonderful. Thank you so much for sharing that. Let's go move on to the next question where it says professional a lot. You hear this a lot. Black people said professional mental health support is not for black people, it's for white people. Can you
Yeah.
speak to that, the myth around that?
So I think that goes back to what I mentioned before about the concept of intergenerational trauma, where they feel like it's not meant for me because it's never been meant for me, because we've had our own way of dealing with stress. We've had our own way of dealing with things such as depression symptoms, anxiety symptoms, and it might not be for me because we've made it this far without it, so I don't need it. But the problem with that mindset is you've made it this far without it, but how much have you truly been living, or how much better off are you without it? And I think a lot of times we've normalized the symptoms that we experience, or the stress that we experience, and we normalize it as a culture to where we feel like it's just a part of us. But in reality, it's not a part of us. It's something that we experience, and something that if we get treated for or find different ways to help manage it, that we will see a lot less stress. We will see a lot more enjoyment and fulfillment in our daily lives and in interactions with people.
Wonderful. So, at your practice currently, do you see children, adults? What's the age range?
So the population I mainly see in my private practice would be adolescents, so later adolescents to adults, and that could be males and females, and with different races and cultures and things like that. It mainly depends on symptomology and what they come to therapy for, whether I feel like I am suitable for them. And that's the thing. Before they even start therapy with me, I do a free consultation to where I can ask these brief questions of what's bringing you here, what are you dealing with, so I can figure out if I'm going to be a good fit for them. Because one of the most important things in therapy and for therapy to work is for you to have a therapist that you trust, a therapist that you can relate to, and if a therapist that is knowledgeable about what you're going through. And if any of those factors are off, then it might not be a good experience for you. So I ask those questions to see if I'm a good fit. And if I'm not a good fit, to help take away some of that stress and frustration, I try to assist these clients in finding a therapist that better suits and fits their specific needs.
Wonderful, wonderful. Now, since you mentioned that, let's talk about some treatment options for depression. So they have mild, I think, moderate, and severe depression. Is that correct?
Mhm. Yeah, so it can be mild, it can be moderate, it can be severe. It can be a single episode, meaning this is a first time you experience depression, or it can be recurrent, meaning things that depression that continues to happen over a period of time, or it can be persistent where it lasts for years at a time without any moments of relief.
So let's talk about a lot of times the reason why Black and Brown people don't seek the help they need. They don't want to go
Hmm.
to the medication route. Right?
Yep.
So, what are other options? We have
Yeah.
individual therapy. If you can just expand on those therapies that you probably would initiate before even moving to a lot of time people want to do a holistic approach. Do
Yes.
you offer that at your practice or okay?
With
If you
my
can speak to that.
practice, I offer it's based off of what they call cognitive behavioral therapy, and I also include some type of trauma therapy, which is called EMDR, and that stands for eye movement desensitization reprocessing. So that's a type of trauma therapy. So there are different therapies depending on the symptoms, depending on the diagnosis. Like I said, one is cognitive behavioral therapy, one is called dialectical behavioral therapy, which mainly helps people with emotional regulation, interpersonal skills, and things like that. There's also something called acceptance and commitment therapy, and that particular therapy focuses on accepting situations the way they are, but it's empowering people to commit to doing a specific action. And what that looks like is, even though I may not want to get out of bed, I find out the things that I value most and I keep those in mind, and then I commit to getting out of bed to do what I need to do my daily activities, because that gets me closer to the values that I have. And there's a whole bunch of other therapies out there. There's another one called internal family systems. That's another therapy approach. There's multiple therapy approaches that are available for different diagnoses or different symptoms. And that's something that I always ask people, even if they don't know what these therapies are, I try to educate them on the options. And depending on the symptoms, I try to help guide them in the right direction of who might be able to assist them, because of they have had more education than I may have in a specific therapy approach. But if my therapy approach will help them, then we'll see that client and we'll try to continue doing the work that way.
That's wonderful since you have that network. If you can
Hmm.
help them, at least you have some place to refer them to get the help that they need. I think that's
Yes.
just brilliant and wonderful. And we have somebody that's watching this right now and saying, I need a therapist. And they don't even know how to vet one. What are
Yeah.
your recommendations? Because
Yeah.
we know for sure finding a therapist is one, but are you having a connection with a therapist? Do you trust the therapist?
Mhm.
What are things people should be asking? What are questions they should be asking this therapist?
A great question, because a lot of times people don't know the questions to ask a therapist at the beginning before they even start services. And what starts to happen is they'll pick someone just off of a picture or pick someone off of a description they see online, and then they go meet with them, and there's not a connection there. And they don't they've told their story once, and they go to find another therapist, and the same thing happens. Now they're told their story twice. Now they stop going because they're getting tired of repeating the same thing and they get frustrated. So something that I believe that could help people with finding a therapist, and before you even get into the therapy process, you can ask questions such as, what kind of therapy approaches do you utilize in therapy? Just like the previous question you mentioned. So trying to figure out, how can you address my specific need? How long have you been doing this? Another question could be, do you have a therapist? Because therapists have therapists and therapists need therapists, because we do hold a lot of safe spaces for other people. And sometimes for certain therapists, it can get overwhelming. So therapists do need therapists. So you can ask them if they have a therapist. You can also ask them um, about their rates, because you want to know about if they accept your insurance, and how, if not, how much it costs. Do they have something which is called a sliding scale, which a sliding scale is based off your income, and based off your income will determine how much the services cost. So things, you can also ask them some type of questions just to get to know them. So it doesn't have to be always be questions about how they can help you, but you want to also get to know them as a person, as an individual, to see if you can connect with them. Because like you said before, we want people that maybe look like us. We want to talk to people that can relate to us. Because if we can relate to people, then that makes us more comfortable in order to communicate with them and to share and to open up.
I agree. I agree. Wonderful. Wonderful. Thanks for sharing that. And we all do know about what's going on in the Black and Brown community. Has the lowest rate of health insurance. We did speak to that a bit, and amongst any other ethnic groups. And, what are some tips for accessing low cost mental health services that you're aware of that you can share with our guests and our viewers?
Yeah, so in certain communities and areas, they do have clinics where that offer low cost mental health therapy, or no cost mental health therapy. So looking for different clinics that might be in your area, but some places also have what they call teaching clinics, to where they have clinicians there, but they also have clinicians that are aspiring clinicians, people that are working up under them, that are trying to get their licensure. So they're being supervised by the clinicians, and that helps get low cost and low cost access to services. So they have teaching clinics around here as well. So it just really depends on what's in your area, and you can always go to your local mental health clinic. So like the county one that's run by the state, and see what kind of services they offer, and if they offer sliding scales and different things like that. So I think people can look for the state run clinics. They can look for any teaching clinics that are around in their area. And they also can look for just any other low cost clinics that are in the area.
It's wonderful, wonderful. I think we've come to our last questions on this interview. I'm going to ask you, you deal with this population a lot, and before we end this, we would like to get a words of encouragement for someone who is caring for somebody who is going through depression, or who is struggling with depression, or who is yet to be diagnosed with depression.
Yes, it's something that I always like to tell clients and other people, is that it did not start with you. Because a lot of times people feel like something's wrong with them, and they ask questions like, why me? Why do I feel like this? Or why am I always alone? And so I always like to encourage them that it did not start with you. What you're probably experiencing is the trauma that you're carrying from various family members or ancestors that was unresolved. And knowing that it did not start with you, you don't have to shame yourself, you don't have to guilt yourself, you don't have to blame yourself for experiencing these as symptoms. And that lets you know that there still is hope, that there's hope for healing, that there's hope for things to get better. And so I always like to tell people, it did not start with you, so that it's not yours to carry. So let's work together to help relieve those burdens that you've been carrying for so long.
Wonderful, wonderful. And on the behalf of the Unfiltered Mind podcast, we'd like to thank you again. But before you leave, one more last question. Are you licensed to practice in what state?
I'm licensed to practice in South Carolina as well as North Carolina.
Wonderful, wonderful. So if somebody's watching this and they're in Virginia, will they be able to do a virtual consultation with you? No?
Well, I'm not licensed to practice in Virginia, so I couldn't do consultations, but I would be able to do different speaking engagements and seminars and things like that if they decide that they want to learn more, or decide they wanted me to come there to speak. I can do those type things, but I can't practice individual therapy in different states that I'm not licensed in.
Again, on the Unfiltered Mind podcast, we would like to thank you, amazingly thank you for your time, and just wanted to be here and share this resources experience with our viewers and our listeners. And we hope that our viewers and our listener will resonate with what is shared here today, And our goal here is really to build a thriving community and to help people to strive to be the best version of themselves. We want to thank you again. And to our viewer and our guest, we say thank you for joining us, and we'll see you on our next episode.
Thank you.
Thank you for listening to Unfiltered Minds Podcast. If you love what you're learning on our podcast, we ask that you please join the Unfiltered Minds community by subscribing and sharing our podcast on YouTube, or you can listen on Apple Podcasts, Google Podcasts, and Spotify. Our dedicated team of ADHD coaches are committed to making a positive impact on the lives of our listeners. Through our thought-provoking podcast, we offer valuable resources, PBT training for ADHD, and a supportive community that understands the journey of mental health challenges. Also, you can visit our website at theunfilteredminds.com, where you can sign up to be a guest on our podcast, as well as sign up for our 8-week parent behavior training course on ADHD.